It is a pleasure to have you all join us today from various corners of the globe. We have a exciting lineup of speakers and sessions planned aimed at fostering collaboration, innovation, and knowledge exchanges about artificial intelligence in nursing. So, without further ado, let us dive into a day filled with insightful discussions and networking opportunity. Enjoy the conference, and it is very important for us to observe our from RNC deputed for this conference, Mr. Kamlesh Sharma and Priyanka Kateva are observing the conference for authentically um, making. Thank you very much and welcome again for this conference. This conference will be fruitful for us as a nursing faculty, nursing uh, personnel, nursing students, and nursing research also. Thank you very much also and again welcome.
Thank you, sir. Now, over, uh, over the next 2 hours, we will be diving into the world of artificial intelligence and its application in nursing practice with our esteemed speakers. First of all, I would like to invite our first speaker, Dr. Amandeep Kaur Bajpa. Currently, she is working as professor in Department of Psychiatric Nursing, Sri Guru Ram Das College of Nursing, Amritsar. She has 25 years working experience in clinical and teaching. She has done MSc Nursing from Siddhganga Institute, Tumkur, Bangalore, and PhD Nursing in 2016 from Himalayan University. She has published scientific research paper in various national and international journals. She has been resource person for national and international conferences. She has organized and participated in various workshop, conference, seminar held time to time. She was elected as the president of Nursing Scholar Society Punjab chapter on 7th November 2021 and conferred as the inspiring icon by UIGIR Academic Research Foundation. She got Excellent Service Award by INSO and she is also reviewer and editorial board member of national and international journals. She is life she is a life membership. She has life membership of TNI, ISPN, NSS, and NRSI. She will be talk about artificial intelligence in healthcare. Ma'am, over to you, ma'am. Please share a PPT on the screen. Welcome, ma'am. Bajo, ma'am. Dr. Amandeep Kaur Bajo, ma'am. Over to you, ma'am. Please share PPT on the screen. You can speak out. Hello, ma'am. I'm waiting for you. Please share your PPT on the screen.
Hello, good morning to all of you. Hello.
Good morning, ma'am. Good morning.
Anji, good morning.
Very good morning, madam.
So today I'm going to discuss about the role of artificial intelligence in healthcare. So PPT. So, is the PPT visible to all?
No, madam.
No.
No, no, madam.
So,
No.
Rajinder,
No, ma'am. No, 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 no.
okay, okay. Rajinder, share from your side only.
Yes, madam. I will share.
You share from your side. I think some problem is there. Now, see, is PPT visible?
Yes, yes,
Yes,
madam.
ma'am.
Okay.
Yes, yes, yes.
Okay, thank you, thank you. So today we discuss about the artificial intelligence. So first, so artificial intelligence is the science of making machines do things that would require intelligence if done by men. So artificial intelligence always operated by the human being. It's not done at self. Okay. So it is John McCarthy, a computer scientist, mathematician, and artificial engineer pioneer, is credited with the coining the term artificial intelligence in 1955. So he described it as the science and engineering of making intelligent machines so that operated by the human beings, and main focus on the use of computers to understand human intelligence. And the artificial intelligence is the intelligence of machines or software, so as opposed to the intelligence of living being, primarily or mainly of humans. Okay, so it is the machine that made by the humans, intelligent machines. So it is a field of study in computer science that develop and studies intelligent machines. So such machine we call intelligence, artificial intelligence. So artificial intelligence already changed much of the world as we know it. It is also called new electricity. As the electricity changes our life, so how we work and how we play, all things are changed, and all things made easy with the help of electricity. Same way, artificial intelligence also change our lives. So from it's changed the decision making from automating system to improving to the decision we make and the way we go about making them. Okay. So, but the most impactful and the personal way the artificial intelligence is changing our world are within the field of healthcare. So, it make the easy healthcare make easy with the help of artificial intelligence. So, where it is being used to diagnose, create personalized treatment plans, and even predict the patient survival rates, especially in case of cancer patient. So, from the level it's first grade, second or third or fourth, we can predict or at that all done by the help of machines or artificial intelligence. Okay. So before proceeding to the topic, we must know about the two things that are already used in the healthcare system. So first is health level 7. So that provide a framework for the exchange, integration, sharing, and retrieval of electronic health information. So these standards define how information is packaged and communicated from one party to the another, and setting the language in which language we can communicate things to the other, and set up the structure and set up the data type required for seamless integration between the system. So health level 7 standards support clinical practice and the management delivery and evaluation of health services, and are recognized as the most commonly used in this modern world. So next is the EHR. So hope Already you heard about EHR, the electronic health record. So we used in the hospital. So it is the systematized collection of patient and population electronically stored health information in a digital format. So these records can be shared across a different healthcare setting. But the main difference between the health level 7 and the EHR, the health level 7 simplify the sharing of medical record between the healthcare provider. So you can take example the sharing of the information between the nurses and the doctors, and from the doctor to doctor, different departments. Then electronic health record, it store the complete historical medical record of the patient, like medical history, surgical history, psychiatric history, all the information related to the patient, all stored in a computer. So advanced technology has already taken the healthcare industry by storm. Okay. So beside HL7 integration services, EHR software development, and mobile health app development, the artificial intelligence is a significantly becoming ever present in healthcare. So first of all, there the main component of the artificial intelligence is the machine learning. So machine learning means in which computer act intelligently on some specific task. So, machine learning is a field of study in artificial intelligence concerned with the development and study of statistical algorithms that can learn from data and generalize to unseen data. And thus, it performs the task without clear instructions. So, algorithm means it's a procedure used to solve the problem and performing the computation. So, compute the information. So please make silence. There's some disturbance coming from backside. Okay. So machine learning, so which focus on some specific task. So it's the most common use in artificial intelligence. So it helps in the healthcare organization to make the prediction about what treatment will possibly be successful with patient and develop personalized medication for them. So the two main use of machine learning, so make prediction and to develop the personalized medication for patients. Next are the main use of artificial intelligence in the healthcare industry or healthcare services. So AI use computers and machine processes to stimulate the human intelligence and perform the complex automatic task. So that is not the single man can't do, but the machine can do all the things. So, reflect the abilities of the human mind. Then AI enabled the machines are also capable of exceeding it in a number of ways. So we can the work of the machine by giving the extension or by making the more data in the machines. So particularly by shifting through large volume of big data efficiently in order to identify patterns, anomalies, any abnormality and trends. So especially during the COVID-19. So it is the machine who tell us how many patients are sufferer of COVID-19. So the use of AI benefit the patient, doctor, administrator, and make the practice by simplifying many complex health-related tasks that typically require human intelligence. So artificial intelligence handle those tasks now at a faster rate. So it can work fast. For the work where is a requirement of more manpower, so we can do only with a single machine. So artificial intelligence is revolutionized the field of healthcare, enhancing the patient care and transforming how the healthcare professional provide services. So let's know how the artificial intelligence is making a significant impact on the healthcare services. So first one is making the diagnose and disease prediction. So in making the diagnosis and disease prediction. So three things are required. So first one is the machine learning. So machine learning algorithm, again algorithm is storage of data. How the storage of data analyze health records and create model for tasks like categorizing the information and predicting outcome. For example, we can make the category of the diagnosis, like how many patient of hypertension, how many patient of having a diabetes, and how many patient have other infection disease. So deep learning, it is a subset of a machine learning. So it handle all the large data volume and produce neural network capable of complex tasks. So neural network means it based on the neurons, how the neurons work in our mind. Okay, so under deep learning, so we deep learning make us to make the early detection of the disease conditions. Early disease conditions, like you can say the diabetic retinopathy detection, early detection of dementia, early detection of Alzheimer disease, and ultrasound detection of the breast nodules, and make the patient safety. Okay. Then like we can detect the wrong things, the fraud detection. So next is the neural language processing. So it interpret human language in verbal or written form, aiding in the or help in the understanding documentation, notes, and research. So for example, we can make the clinical documentation. Again, we can categorize the patient and document the thing according to categorization. Then we can uh, make the clinical trial matching. Okay. And we can create the computer program and decision making, enhance the decision making, and we can make the identification of the patient at risk. So next part, next the function in healthcare services. So the robotic surgeries, nowadays it's very common. All the major surgeries like knee transplant, hip transplant, so it is done with the help of the robots. So all equipped AI equipped or artificial intelligence equipped robotic surgical tools assist surgeons during the procedure, so by providing real time information and minimizing the physical fluctuation. So these tools enhance precision and surgical outcome. So over the process is the control of a human, but the robotic technology only assists surgeon with delicate and more precise surgical motion. So for example, already I give the example, but in Mayo Clinic in Florida use artificial intelligence powered robots to help with the execution of abdominal surgeries, and now developing more for operating on the brain also. So in nursing, so we use robots as ambulation support, okay, to ambulate or to make mobilization of the patient, then to take the vital sign measurement, then medication administration, and to make the protocol for the infectious disease condition. So Sophia is the first robot that in a healthcare services that introduced in the Saudi Arabia in 2018 to provide care to the elderly couple. Okay. So Sophia is the first robot in the healthcare industry. So third one is making the personalized treatment plans. So artificial intelligence analyze the patient data to recommend tailored or well planned treatment option. So from the history of the patient, for example, patient come in the hospital for an admission or taking advice in the OPD. So we can make the history of the patient. Okay. And we can give the reminder to the patient like their diet plan, their follow up. Okay. So it consider the individual factors like genetics, medical history, and lifestyle to optimize the care. So we can give reminder to the patient time to time regarding their treatment regimen. And fourth one is the drug development and research. So artificial intelligence accelerate drug discovery by analyzing the vast database and identifying the potential compound. So from the previous records, we can make the assessment which drug is more impact on the disease condition, then we can use these drugs, those drugs who are the more potential or who are the more impact on the patient condition. So it predict drug interaction, side effect, and the efficacy of the drugs. So fourth is function is patient monitoring and care. So artificial intelligence monitor the patient health parameters, so altering clinician to the anomalies. So for example, so on a multi-channel monitor, even we can check the ECG pattern, and we can see the heart rate of the patient, and respiratory rate, oxygen saturation. So we can check various parameter on a one monitor. Okay. Even the temperature also, okay, or blood pressure. So we can check on a multi-channel monitor. So it aid in disease surveillance, outbreak response, and health system management. So especially during the COVID-19, artificial intelligence play a very important role. Okay. So from the news or from the like the test we done in the laboratories, we can came to know that we have a coronavirus. So we can take measure according to that. So next, the future perspective for the artificial intelligence. So the adoption of artificial intelligence in healthcare is expected to grow significantly by 2030. So the value may be going to double. So all artificial intelligence potential or possibilities lie in improving the diagnosis speed, treatment effectiveness, and overall patient outcome. So the artificial intelligence make the speedy recovery of the patient and fast diagnose of the patient. So if the early diagnose, we can provide proper treatment or early treatment to the patient, and it will enhance the speedy recovery of the patient. So next, the tool, the artificial intelligence tool we use in a nursing. So in nursing, the clinical decision support tools that include the clinical practice guidelines. So there is a practice guideline for every procedure in a nursing, like how to take, how to give bed bath, how to give medication. So every procedure having some specific guidelines that should be followed by the nurses. So reports, we can make assessment of the report of the patient, like patient having the less HB, then we can make the diagnosed patient having a anemia, and order sets that help the nurses to make clinical decision more efficiently. So mobile health, there are three things which we use in a nursing field with the help of artificial intelligence. So first is the mobile health and sensor based technologies that enable the patient to remain at home and the nurses to monitor patient remotely. So like we can ask the patient to check their glucose level daily on a glucometer, and glucometer is also a example of uh, AI, and the pulse oximeter. With pulse oximeter, they can check their oxygen saturation at home. And the big example, the Holter monitoring. So if the patient having some cardiac anomalies, we can tie the Holter on the chest of the patient, and patient can go to home, and we can make assessment about the ECG changes. The next one is the voice assistants, digital companions, so that utilize artificial intelligence, voice recognition, and natural language processing to interact with users through spoken language. So we can make spoke to the patient. Okay. And third one is the main nursing school that already having the chat box to create mock simulation, so that it resemble real life nurse patient interaction. And there are talk of robots that will work and interact in clinical nursing environment. So TNA also arrange the simulation training for the teachers, for the students. Okay. So many programs are run by the TNA for the teachers to give simulation training, so that they can give training to their student. So next, the benefits of artificial intelligence in healthcare. So, artificial intelligence provide a number of benefits to the field of healthcare. So, the professional, the working within it, the professional means the doctors, the nurses, the patient that interact with it every day, they get the many benefits. So, while healthcare professional can expect lower operational cost due to improved decision making and more efficient automated services, so provider can leverage the technology to design bespoke treatment plans and diagnose conditions more quickly and accurately than they could alone. Okay. So patient also get the benefit and doctor and nurses also get benefit from the artificial intelligence. They can make diagnose early, they can provide treatment early. Okay. Then patient can expect potentially improved health outcomes and lower cost resulting from more efficient health services. So the patient can stay at their home, they don't have to pay the charges of the hospital. So it can become a low cost treatment for the patient with the help of artificial intelligence. Healthcare analytic. So the machine learning algorithms are trained using historical data to produce insight, improve decision making, and optimize health outcome. So with the help of machines, we are able to reach diagnose at early as possible. Then artificial intelligence used to produce personalized treatment plan for patient, so that account such factor like their medical history, environmental factors, lifestyle, and genetic makeup. So we can collect the history of the patient easily, and we are able to provide precise medicine according to their history. So then predict disease and illness. So using the predictive model, healthcare professional can determine likelihood that someone might develop a particular condition or contract a disease. So, for example, there is a specific area where a water is contaminated. So, what can be the possibility? There can be a possibility of typhoid. So, healthcare provider can make the early diagnose, okay, or can do the preventive measures, then interpret, test, and diagnose disease. So machine learning models can be trained using common medical scans, so like MRIs, especially in the head injury or any clot in the brain, x-ray, ultrasound, to interpret and diagnose such condition as like the cancerous lesions. Okay. So the diagnosis of cancer can be made at the first stage, and we can increase the life of the patient. So there are some job possibilities in the sector of artificial intelligence. So both artificial intelligence and the healthcare are growing field, so that are projected to have a big impact in the coming decades. So it is a little surprise then that all artificial intelligent orient position are becoming increasingly common within the field of healthcare. So many people don't have a awareness of these jobs. So here are some of the position we can consider. Okay. So first one is the position like health informatics specialist, who provide all the information regarding the health conditions. And second position is machine learning engineer. So the person can do become the machine learning engineer. Then third position, data scientist. So data scientists make the storage of all the data. Then fourth position we can take the artificial engineer. So these four positions are now usable in the artificial intelligence industry. So artificial intelligence application in healthcare. So as artificial intelligence become more widely adopted, so too does the number of ways the technology is being used across industries. So now the people are focusing on the machines rather than the man. So researchers don't expect artificial intelligence to replace healthcare professional just yet. But again, some controversy is there. So there is a need of man to operate the machine. So in healthcare is not much replacement there, but in future can be. So there is a need of doctor and nurses to operate the robots or to operate the machines. So instead, they see it as supporting and improving the work of the healthcare provider and professional in the near future. So the artificial intelligence can enhance the work capacity of the doctors or nurses in the healthcare industry. So, but with these prospective or uses, there are some challenges we can face in the artificial intelligence. So, first challenge is the storage of data. So, high quality data is the lifeblood of artificial intelligence. So, artificial intelligence totally based on the storage of data. So, if anything wrong in the storage, the diagnose can be wrong. So, however, obtaining sufficient label data for training models can be challenging. So data scarcity affect the performance and generalization of the artificial intelligence system. Then artificial intelligent models can inherit biases present in their training data. Again, there can be some error in the data. So these biases can lead to the unfair or discriminatory outcomes. So, ensuring fairness and mitigating bias, it is also a critical challenge. So, sometimes the machines can also make the wrong diagnose on the base of data. Then, privacy and security. So, always there is a risk to steal the data. So all artificial intelligence system become more pervasive, protecting user privacy and securing the sensitive data become paramount. So striking a balance between the data utilization and the privacy preservation, it is also essential. But sometime there can be a virus in the system, and that due to the virus, all the system can be spoiled. So there it is also a big challenge, the privacy and security of the data. Then fourth challenge is the transparency. So artificial intelligence model often operate as a black boxes that are the hidden boxes. So making it difficult to understand their decision making process, and enhancing transparency and interpretability is crucial for building trust. So when transparency is not there, the patient or the people are not able to make trust upon the results or outcomes. Then ethical dilemma. So artificial intelligence application raised ethical questions. For instance, how do we handle artificial intelligence driven decision in a critical domains? So like healthcare or criminal justice. So striking the right balance between innovation and the ethics is a challenge. So sometimes the patient was critical or is critical, but within a moment patient because the condition patient is normal, but within a moment the condition of the patient it changed. Patient become critical. So in that case there is a ethical dilemma. So due to the reading shown by the monitor, we are not able to convey proper result to the patient relative. Okay. So there can be a dilemma. Then while artificial intelligence can boost productivity, it also raises concern about job displacement. So preparing the workforce for the changing landscape is essential. So the artificial intelligence replace the man with the machine. Sometimes it is not acceptable. So it should be uh, awareness. There should be awareness to change the landscape. So other thing is the deep learning complexity. So deep learning, already I told, deep learning क्या है? It is the transfer of the
Yes.
information from one to the another. Okay. So deep learning model are powerful, but it's a complex. It sometimes it is not in hand of the human to operate the deep learning model. So simplifying their architecture and making them more accessible to developer, it is an ongoing challenge. So next one is the scalability. Scalability means we sometimes we have to make differentiation between the things, but with computer we can't make the differentiation. So as artificial intelligence system grow in the complexity, ensuring the scalability. It's become crucial or important. So, how we can deploy artificial intelligence solution across the diverse domains without compromising the performance. So, sometimes we are not able to divide it accurately or equally. So, solving all these or artificial intelligence challenges require collaboration across all the fields like computer science, ethics, law, and more. So, bridging these discipline is essential for progress. So, otherwise, the artificial intelligence can be wasted. So, so any query, anything you want to ask? So, thanks for patient listening.
Thank you, madam. Thank you, madam, Dr. Amandeep Korbaja, madam, for
Thank you,
enlightening.
sir. Thank you for inviting me.
Thank you, madam, for enlightening and informative. Please mute your mic. Please, everyone, please mute your mic. Thank you, madam, for enlightening and informative presentation about the role of artificial intelligence in healthcare. Thank you very much. Now, I would like to invite our next speaker, Dr. Amandeep Kaur Dhillon. Uh,
Ramandeep. Ramandeep.
Ramandeep Kaur Dhillon. She is principal in Ajit Nursing Institute, Sunam, Punjab. She has got award, Sarla Kapoor Award for best research paper, and she is uh, interested in child psychiatry. Welcome, ma'am. Just I will share PPT on screen.
Yes, sir. Thank you. Thank you very much for sharing my screen.
Hello, ma'am. Please, you can proceed.
Sir, am I audible?
Yes, ma'am.
Okay. Thank you very much for sharing my screen. And first of all, good morning. And thanks the organizers to invite me as a speaker. I think so. There is an echo. Shall we go for next slide? Am I audible? If am I audible, please go for the next slide. Thank you. Thank you very much. So as Dr. Bajwa explained, beautifully what is the role of the artificial intelligence nowadays in healthcare sector. So I just want to concise her all overall presentation, a quote that is given by Albert Einstein, to whom we know very much. He said, computers are incredibly fast, accurate, but stupid. And on the other hand, human beings are incredibly slow, inaccurate, but brilliant. Together, they are powerful beyond imagination. And this is today's our topic of discussion for the whole day. That is the role of the artificial intelligence. Next slide, please. So, first of all, we want to try to understand what is the meaning of the informatics. Informatics means computer science and information science. When we use the computers to process the information to enhance the quality of care, it is known as the nursing informatics. Next slide, please. So there are one or two definitions that are given by some others. First one that is given by Thompson's, that is computer science, information science, and nursing science combined to assist in the management and processing of nursing data, information, and knowledge to support the practice of nursing and the delivery of the nursing care. That is the ultimate goal of any science in the nursing area. Another definition that is given by American Nurses Association, that is nursing informatics is a specialty that integrates nursing science, computer science, and information science to manage and communicate data, information, and knowledge in nursing practice. Nursing informatics facilitates the integration of data, information, and knowledge to support patients, nurses, and other providers in their decision making in all roles and settings. This sport is accomplished through the use of information structures, information processes, and information technology. So, overall crux is that every information is used to enhance the quality care of the client. Next, please. So, first, we should know what is the history of the nursing informatics. We know that Florence Nightingale has used the data while in the Crimean War too. She is also known as the mother of the statistics. So, Florence Nightingale has been recognized the use of informatics, and he started the use of data to inform the knowledge and then change the nursing practices. Then in 1963, she was very clear in her desire to collect, retrieve, and analyze data to be able to recognize trends in illness and treatments to improve the quality of the care. With this data collected during Crimean War II, Florence Nightingale, uh, we can say that he invented the theory of the environmental hygiene. She told the world that just keeping the hygiene among the clients, we can enhance the wound care. The next is in the 1950s and 1960s, many significant changes were underwent for healthcare and for the nursing profession in developing countries. In 1977, the nursing staff becomes instrumental in the development of nursing application for hospital information system. And then in 1970s and in 1980s, nursing informatics was broadly defined as the use of computer technology to support all aspects of nursing practice, and it was frequently confused with the computer literacy skills of the nurse. Here, I just want to inform that in 1992, America has given the recognition as a subject and specialty to the nursing informatics. Then in during 1990s and beyond, the internet became the tool for web-based clinical applications for healthcare professionals. Then in 1996, truly introduced a model that illustrates the interaction of the sciences that contribute to nursing informatics, computer science, language processing, and then visual attention. Now, the present scenario is nursing informatics has become a part of our professional activity. We are using computers, we are using the artificial intelligence in each and every area of the nursing. Either it may be nursing practice, nursing education, nursing administration, and also in the nursing research. Then informatics has advanced the field of nursing by bridging the gap from nursing as an art to nursing as a science. So we just read in the books that nursing is a blend of art and science. But with the introduction of the computer, it now truly becomes the science. Now, another, it is the view of someone. I got it from the internet. If Florence Nightingale were alive today, she would be extremely pleased with the nursing informatics tool, which uses science, nursing statistics, and evidence based care as a time saving intervention with the ultimate goal of helping patient in the best manner possible. So this is the dream of the Nightingale, which she dreamed in the era of 18th century. So this is the triad of the nursing informatics. So we will see in this triad, in this triangle, that first of all, there is a data. This data becomes the information related to the client, and then this information is converted into the knowledge, and then with the use of our wisdom, this data, this information, and knowledge, we will make a best possible decision for the client. Next, please. Then this is the nursing informatics model. So we will start from the left side. So here is a healthcare system. It affects the nursing education, practice, research, and administration, which also affects the healthcare system. And on the right hand side, there is a computer and information science. Again, it affects the all the four areas of the nursing. And we will see here that all these four areas also affects the computer and information science. So we can see from this model that all the components are interdependent on each other. So at the base of this model, we will see data is processed, becomes information, and then it is transformed it into the knowledge, which we have already discussed into the triad of the nursing informatics. So there are some functions of the nursing informatics. First of all, nursing informatics, it allows to access the health information to order, implement, and evaluate methods of the patient care. Then nurses are also well versed to review all the information related to a particular patient on the online with the help of the informatics. Next, please. Okay, so here is the example. So I have a patient, I have a data that at 9 a.m. my patient has blood glucose level 100 milligram per deciliter. But at 4 p.m. this data is 180 milligram per deciliter. So I have a information that time 9 a.m. glucose is 100 milligram per deciliter, and at the 4 p.m. blood glucose is 180 milligram per deciliter. So this is the information. So now, what is the knowledge? My client glucose level rises in the late afternoon, so his insulin dose needs to be adjusted accordingly. So this is the whole thing. Then come to the importance of the nursing informatics.
It enables the appropriate flow of data collected by nurses. So we collect the information, we feed it on the computer, and then this data goes to the physician, to the lab experts, to the radiology experts, to the other health professionals which are related to that client. Then improving access to the patient information at the point of the care. So we don't need to go for the files. We just open the account of that particular patient and then we can access the patient information at any place. And thus enhancing, please, thus enhancing nursing, last slide please, thus enhancing the nursing abilities to a benchmark means quality care and then monitor and audit quality measures. So this is the whole crux of the nursing informatics. Next please. So what is the information health information system? This is the another component of my presentation. It is commonly known as HIS, or we can say MIS or HMIS. It is a system that is really where information system meet healthcare to help optimize the acquisition, storage, retrieval. This is the main thing, and uses of information in health and biomedicine. So, health information system is that system in which collection, utilization, analysis, and transmission of information is done for conducting health services, training, and the research. So, this health information system it is related to the health of the client. Either it is in a good condition, or the client may need some type of treatment or some type of therapy. Next, please. So, health information system is known as the memory and the nervous system of a hospital. How it acts as a memory? Because all the data is stored related to the patient in the computer. And how it acts as the nervous system? It provides that information to all the peripheries. Wherever I want to access the data, suddenly I just remember something about my client. And then I just want to check either it has been done for the client or not. Please ask to mute the mics. Sunil Kumar. Okay. So, nervous system provides that information at all the peripheries. Next slide, please. Then, what are the characteristics of this HIS or health information system? The information should be problem oriented, first of all. That is very much important. Whatever the information has to be uploaded on the system, it must be problem oriented. Then, information should be population based, means what is the population we are supposed to collect the information. Then, functional and directional wording should be used. So it has a proper training which is given to the healthcare professionals. And nowadays, in our BSc nursing, this new subject has already been introduced by the Indian Nursing Council. And this syllabus also tells how to use and which type of vocabulary has to be used while using the information system. So, information should be expressed in short and in imaginative forms like graphs, charts, and table. Means we can just at a one glance know what is the condition of the client, what type of information is provided by the other health professionals for the client. Next, please. Yeah. Then we will continue with the characteristics. There is a facility for data feedback must be present. If I want to introduce mine comments, their facility must be there. Then latest technology should be used in health information system. So we should not stick about the Windows 93 or 2003. We should go and update ourselves with the latest technology. Then unnecessary figures or data should not be present because it will confuse every health professional. For information management, organizational structure must be present. So it is not an easy job to introduce the health information system in any organization. Next, please. So, what are the domains of the health information system? So, it includes demography, vital statistics, health system input as well as output, health determinants, health economics, health status, health infrastructure, resources and outcome, financial statistics, environmental health statistics. So, how this information process in the hospital or in the organization. So, first of all, there is the data collection that we have collected the information about the client. Then that information has to be transmitted, and then there is a processing of the information. For example, I have to use that information, physician has to use that information, psychiatrist or the therapist wants to use this information. Then that information is analyzes for the planning and the management care of the client. And on the other hand, we will see that there is a management of all this information flow with the help of the resources and the organizational rules. Means all this information is confidential, and organization rules set that it should not be accessible to anybody. It should be accessible only to the concerned person. So there are some resources. Resources means everything related to the client. Lab reports, radiology reports, ultrasound scans, doctor's notes, nurses' notes. So all these informations must be managed in a confidential way. Next, please. Then, what are the sources of the health information system? So, census, we know what is the census. Then, registration of vital events like birth, death, or marriage. Then, notification of any diseases or disease register, for example, corona. Then, records and reports of the hospital. And we know these records and reports are very, very important. Then, statistics regarding environmental health. Then sample survey, population survey, statistics regarding efforts to check epidemiological diseases and research, school records, economic planning, plans of the social security. So all these are the sources from where we can collect the information regarding our client. Then these are EHR, that is electronic health records, which are collected by individual who is a patient and his immediate family, then community health services, pharmacy, prescriptions, dental visits, podiatrists, psychologists, social workers, optometrists. So every sphere of the hospital contributes towards the electronic health records. Then, what is the significance of nursing informatics in the information system? That is very, very important because we have now to combine both verticals into the one slide or two slides. It is an effort. So, first of all, there is a quality factor. If nursing informatics is knowledgeable, only then health information system becomes quality improved. Then cost factor, obviously we are writing on the papers, then those papers are then added to the file of the client. Client is carrying a file, have heavy file in his hands when he comes for the doctor visit. There is no need of such things. So we are saving the papers, thus we are saving our mother earth. Then productivity factor, obviously if quality is good, cost is less, then productivity will enhanced. Then it offers holistic view to patient as well as to the hospital. Then decision of healthcare professionals depend upon, last slide please. Last slide. Okay. Professionals depends upon the vast information about the patient's health status. So this is only the patient health status is only the major data that has to be for the dependence of the nursing informatics as well as the HIS, that is Health Information System. So it is essential for the quality of the patient care, for the quality of the hospital management to fulfill these information needs. Next, please. So we can understand all these things with the example. When a patient is admitted to a hospital, then a doctor or the nurse, they needs the information. We collect the primary data from primary source as well as from the secondary source. We know all these things. Then why patient comes? What is the reason of patient's admission? What is the history of that particular disease for which patient is here for the admission? Then patient needs result from the services as laboratory radiology, which are some of the most frequent diagnostic procedure for each and every patient who comes for the admission. If these reports are incorrect, it may lead to erroneous and even harmful treatment decision. If the patient has high level of blood glucose level, but it does not reflect in his laboratory reports, then he may be given dextrose 5%, but it may become harmful for the client's condition. Then repeated examinations are lost, findings have to be searched for, the cost of healthcare may increase. Next, please. Then impact of nursing informatics on the hospital information system. So how nursing informatics contributes to the health information system of the hospital. So there is a progress in information and communication technology. It changes the societies, thus affects the quality and the cost of the information processing. Then there is an important progress due to the improvements in the modern ICT, which can also be observed in the information system of the healthcare organizations. Then the role of the computer supported information together with clinical documentation and knowledge based decision both support this system. And it hardly be overestimated with respect to the quality of the healthcare, as the volume of the data available today is much greater than it was a few years ago. Next, please. Yeah. Due to the importance of information processing as a quality and cost factor, an institution has to invest systematically in its health information system. These investments concern both staff and tools for the information processing, which aim to increase quality of the patient care, which is the ultimate goal. Then unsystematic information processing normally leads to be a low quality of health information system. Thus, information needs of the staff and departments cannot be adequately satisfied. Next, please. Okay. When health information systems are not systematically managed, they tend to develop in a chaotic way. Obviously, there is a chaos when there is a lot of information overloaded into the system. And then it has severe consequences, which may be decrease in data quality, cost may be increased, and it may not mention the aspects such as data protection and data security violation. Insufficiently managed information system can contribute to breakdown in established clinical workflows also, which to are reduced efficiency of care to user by cart to decrease quality of care and even endanger patient safety. To adequately process information and apply information and communication technology, knowledge and skill for these tasks are required. Next, please. Okay, so this is the end slide. I try to justify with the topic. With the conclusion, you may understand the time has come for healthcare to leave the manual tools of the past in the past and then turn to enables of the 21st century. The nursing profession is being transferred to meet the needs of the new world and will be a major player in the revolution. So I will conclude my whole presentation with the last slide. Please go for the last slide. It is very important. Please show the last slide. Last slide, please. Am I audible?
Yes, ma'am.
Yeah. Next slide to this.
Just a minute. Madam, this
No,
one?
no, sir. Last. Next to conclusion slide. No, no, sir. Downwards, please. Downwards. Down. Down. Yeah, this is. So, no, sir. Yes. So, sir, previous one, please. Yes, sir. So, Virginia Sava in 1992, he recognized what is the importance of the nursing informatics, and with his wise words, by the turn of the century, most healthcare delivery system will function with computers and will be managed by computer literate nurses. I believe that by the turn of the century, high tech and high touch will be an integral part of the healthcare delivery system. So this was set in 1992 by the Virginia. She is a, we can say, very having very far vision. So she realized and recognized the importance of high tech and the high touch, and in the tertiary care hospitals, and we are doing both these things. With this, thank you, and I am open for the session. If anybody wants to ask any question.
Thank you. Thank you, ma'am, for
Thank you, sir.
insightful presentation about the role of nursing informatics in HIS. Health information system which are used widely in hospitals nowadays. I hope everyone will be benefited with this presentation, especially health personnel working in hospitals. Thank you, ma'am. Thank you so much.
Thank you, sir. Thank you very much.
Now I invite our next speaker, Dr. Jayant Misra.
Sir, good morning.
He is Pinci. Good morning, sir.
Sir, am I audible to you?
Just a minute,
Am I
sir.
audible to you?
Yes, sir. Yes, sir.
Yeah, thank you, sir.
Dr. Misra is a principal, Maheshwari Group of Institution, Odisha. She is former professor, SRMU